I'm Leslie Boyd. I live in North Carolina. This is my son, Michael, who was born on my birthday in 1974 and died on April 1st, 2008. He died of neglect. He died of negligent homicide by a system that refused to help him because a birth defect was a pre-existing condition. And that is why we can't leave healthcare in private hands. My son needed a colonoscopy every year because that birth defect left him incredibly vulnerable to colon cancer. By the time he was 25, he'd already had precancerous polyps snipped from his colon. He decided he would go back to school because the only time he ever had health insurance, there was a rider that said they would not do anything that had anything to do with his birth defect. He figured if he went back to school, he could get a job that would take care of things. He bet that he had 4 years to finish school and law school. He lost the bet. He moved to Savannah, Georgia, where no one would do a colonoscopy. He would go to the doctor, and the doctor would write in his chart, "Patient needs a colonoscopy but cannot afford it." He got sick, and the doctor said, "Wow, you really do need a colonoscopy." And Michael said, "Would you do it and let me pay it off?" He said, "No, $2,300 cash, no checks, no plastic." Mike got sicker, and he went to the emergency room, which, now you know the emergency room has to take care of anybody who comes, but they don't. They only have to stabilize you. And they stabilized my child with painkillers, antibiotics, laxatives, sent him home with the wrong meds, the wrong diagnoses, and a bill. By the time anybody would do anything for him, he was down to 110 pounds. He was 6 feet tall. He was vomiting fecal matter, and his kidneys had already shut down. It took them 5 days to stabilize him enough to do surgery. And after the surgery, they did chemo and radiation. He got sick again because the radiation caused a stricture in his small intestine. This time they let him get down to 104 pounds. And then when they found a few viable cancer cells in the pathology report, told him, bye-bye, that's it, and didn't even treat a life-threatening infection. We took him to Duke for a consult in North Carolina. Duke adopted him, did everything they could, and gave us another 2 years with him. But he died anyway. He was a remarkable human being. He was a recovering addict who spent 11 years pulling addicts out of the gutter and helping them recover and stay in recovery. He should still be here. He had to leave his wife to get Medicaid. He applied for disability. It took 37 months. His first check came 9 days after he died. This is how we treat people in this country. Now, I want to tell you, I have friends in Canada. They love their system. They love it. Someone told me the other day, she's a Canadian citizen, and she said, you know those rumors of people coming across the border to get health care? You know who does that? Wealthy Canadians who don't want to wait a couple months for hemorrhoid surgery. That's who rushes to the United States. People in Canada know that if they get sick, they get care. People in France know that if they get sick, they get care. People in England know if they get sick, they get care. People in the United States know that if they get sick, they're going to go bankrupt before they die. Now, when my son died, one American was dying every 12 minutes from lack of access to care. There are still at least 17,000 people dying every year in this country. That's with Obamacare. Thank God some of those 45,000 lives have been saved. But which ones? Who decides? Why do we let anybody die? Why do we scream about poor Cecil the lion and not have any outrage for my child or your child or anybody else's child? Why do we scream about being pro-life and then not pass single-payer care? That is not pro-life. Do not ever call yourself pro-life to me if you are anti-universal health care, because you are anti-life. You will not be pro-life until you support everyone having health care as a basic human right, until you support feeding children, until you support a living wage, safe neighborhoods, decent education. All of this together, you can't just fix one piece of it. People deserve a decent life. My son deserved to live. And that changed my life forever. He was born on my birthday. You can believe my birthday is pretty bittersweet now. But I will tell you one thing. I am in this fight. I'm in this fight. I'll be carried out feet first. You will not walk away from me. You will not tell me that you won't vote for single payer and then call yourself pro-life, because I'll call you out, and I've done it. I've done it to members of Congress. I've stood up, held up my son's picture and said, no, sir, you are not pro-life. You voted against the Affordable Care Act. You refused to vote for single payer. You are anti-life. And until we all call them out, they're going to walk around saying they're pro-life when we know better. We need to call them out. We need to vote. We need to be active. We need to be willing to go to jail if we have to. I've done it twice. I'll do it again. And I will not ever give up until every single American has a right to decent health care every time they get sick. I hope you'll be with me. Thank you.